Good afternoon.
Hello.
My name is Dr. Bull. I'm one of the doctors in clinic today. Thank you for coming in. Can I just get you to confirm your name and age for me, please?
Walter Elliott, I'm 66.
Nice to meet you, Mr. Elliott. So, tell me, why have you been coming in to see the GP recently?
Oh, my wife. Well, she's got it in her head that I've lost weight. Now, who goes to a doctor because they've lost weight? But to appease her, I said, right, I'll go. So I saw the doctor a little while ago.
Okay. And do you have any concerns about your weight loss?
No, not really. I mean, I can afford to lose a bit of weight.
Okay. And do you have any ideas what might be causing you to lose weight?
No idea, no.
Okay. And so, can I just ask a few questions just to get to know you a little bit better and what's been happening? You've lost some weight. Over what time do you think you've lost that weight?
Over the past month or so, maybe.
Okay. And do you know roughly how much weight you might have lost?
I don't know. I mean, my trousers are loose, that's all I know.
Okay. And have you been having any tummy pain at all?
No.
No? And it's quite a personal question, but have you noticed any bleeding from your back passage?
Oh, no, nothing like that, no.
Okay. All right. And so you saw your GP a few weeks ago. What happened after that?
Well, they sent me for a scan. I had blood tests done at that time.
Mm-hmm.
They also looked at a stool sample, which he said was clear.
Okay.
So I think he felt it was all going to be fine.
Okay. All right. And you yourself, do you have any worries at all?
No, not at all.
Okay. All right. So we've got the results of the scan back. I'm happy to give you those results today. Are you happy to talk about them?
Yes, I came in for that. Yeah.
Okay. And do you have anyone with you today you'd like to bring in while we talk about the results?
No.
No. Okay. So we do have the results back, and unfortunately it's not the news we were hoping for. The scan suggests that you have a bowel cancer that's possibly spread to your liver.
Sorry, cancer?
Unfortunately, yes.
Oh dear.
Now, I know this has come as a big shock and you weren't expecting it, but I think it's important we talk about what we're going to do next.
Oh dear. How long have I got?
That's a very difficult question to answer at this point. What I think we need to do is do some more tests, speak to some more people, and then when we have more information, we'll be able to give you a better idea of that.
Right. Oh dear.
Okay.
Yeah,
Are
carry on.
you happy for me to tell you what I think the next step should be?
Yeah, please tell me what it is. It's going to happen.
So firstly, I would like to refer you to our cancer specialists. They're called the oncology team. And I'd like to see them within the next 2 weeks.
2 weeks? That's fast.
Yes, it's important that we get things moving, and I think we'd like you to see them within the next 2 weeks.
Right.
Okay. Other things that I'd like to do is I think we need more scans, so I'd like to organise those for you. And it may be that we need to get a sample of the cancer, what we call a biopsy. Okay. Have you heard of a biopsy before?
I've heard the word, but I don't exactly know what it is.
Okay. So it's where we take a little bit of the cancer, we take a piece of it, and we have a look at it, and it tells us quite a lot of information about how we can move forward with treatment.
Yeah.
Okay. Other things I'd like to do for you today is to give you the contact details for our specialist nurses, the Macmillan nurses. Have you heard of the Macmillan nurses before?
I've seen them advertised on TV, yeah.
They're an absolutely fantastic service, and they can help support you with everything that's going to happen in the next few weeks. Okay, and they can offer some support to your partner, your wife as well. Okay. That's obviously quite a lot.
Yeah.
Do you have any questions at this point for me?
So what happens next then?
Okay. So we've talked about getting a referral to the cancer
Yeah,
doctors.
and after that, what happens then?
So then we can start talking about what treatments we're going to offer you, okay? And we will have a conversation, the oncologists and you and myself as well, if you'd like me to be involved, and we will talk about what what treatment options are the best things for you. Okay, now that may be surgery, that may be chemotherapy, and that may be radiotherapy. Okay, have you heard of any of these things?
I've heard of them all. Does it mean that will give me longer?
Again, we don't have all the information at the moment, so it's very difficult for me to say, and the oncology team will be best placed to say. Okay, but this is very early in your journey. Okay.
Yeah, so you caught it quite early then, so that's a good thing, isn't it? That means that it could just get cured.
So unfortunately, from the scan that we've done already, it shows that your cancer has progressed to your liver. Okay.
I just wasn't expecting this news today.
I know, I'm sorry, it is a lot. It's very unexpected. And I know
It is.
My colleague wasn't expecting it either.
Oh dear.
But it is important that we keep moving forward and we plan these next steps.
Yeah.
If it's all right with you, I'd just like to summarise what we're going to do next. Okay? So I'm going to refer you to see our cancer specialists in the next 2 weeks. We're going to organise some more scans and possibly do a biopsy to take a bit of the cancer and have a look at it. I'm going to give you the details for our Macmillan nurses who can support you at home and answer any questions you might have in the short term. And I'd also like to make an appointment for you to come back and see me in a week's time. And I'd obviously invite your wife to come with you, and we can talk about any other questions that you might have and continue making plans for what's going to happen next.
Yeah.
Okay? Do you have any more questions?
No, but my wife will have loads. She'll think of lots of things to ask.
Absolutely.
But I've got nothing.
And I'm happy to answer any questions you or your wife have. We'll see. I will make an appointment in a week, but if you want to see me before that, please contact us. Okay. How did you get in today? How did you get here?
I just walked because I live round the corner.
Okay. And do you think you'll be able to get home okay?
Yeah. I'll go outside. I'll ring my wife. Ask her to come up.
Okay. All right. So I'm going to give you some information, some leaflets before you go as well. But we're here if you do need us.
Yeah.
And as I said, I'm sorry to give you this news today, but we're going to move forward with it.
Yeah, sure.
Okay. Thank you very much, Mr. Elliott.
Thank you, Doctor.
Okay.